Bonjour à tous, je suis le docteur Philippe N.
Good morning, ladies and gentlemen. I am Dr. Philippe N, responsible for research at the Charité University Hospital Center of Berlin. In addition to clinical medicine, I am responsible for classes. Apart from medicine, I also studied public health. I would like to talk today about medical topics which are related to my field and very important for our country. That's why I will begin with clinical medicine, then research, and finish with teaching. As concerns clinical medicine, my experience I had in my country allowed me to observe that there is a less motivation in the medical field because of many reasons, ranging from the lack of infrastructure to lack of funding. Many people are not at their workplaces because they also work in private structures. And it means during the free time, they'll go to private places to earn much money. Generally, doctors in Ivory Coast work from 10 a.m. to 3 hours of work per day, instead of the normal 8 to 10 hours per day in a public structure. This is not enough. And after 3 hours of work in the public structure, the doctors go to work in private structures to serve other patients. That's something I personally had the opportunity to observe during my stay in Abidjan. Here in Berlin, we start work at 7:30 a.m. and finish at around 18:19. This is obviously too much, but we have enough time to take care of our patients. I think it's important for the Ivorian government to take strong measures against these malpractice habits. It means those who want to work for the public structures have to do their job correctly and should not be allowed the right to work in private hospitals. The second point I would like to talk about is the lack of doctors, due to the fact that the Public Function Ministry introduced an examination for the doctors as a prerequisite to work in public services. Due to the fact that there is a lack of doctors, I think this examination is not really necessary because it creates a barrier in the health system. In case the government has no money to employ everybody, they should create stimulating measures to allow many young brothers who finish their studies to be able to organize themselves to create polyclinic centers where the population will receive good treatments at cheaper costs. This may be considered as alternative since these young graduates will be acting as job creators and not job seekers. About the general training of doctors, it takes about 6 years, 3 months in Germany, whereas it takes an average of 8 years in Ivory Coast and ends with the title of doctor in medicine. I don't think we need this long training of 8 years in Ivory Coast. For the major pathology in Ivory Coast, we can train some intermediary people for a period of about 4 years. These people will be capable of treating the major pathologies afflicting our countries. Concerning the field of research, We know it's difficult to talk about research in developing countries in general, but I believe we have to talk about this issue because if we do not do it, nobody else will do it for us. There are major pathologies affecting us, so we have to approach them. We can approach the field of research in South-South cooperation. During my last stay to India, I noticed that India as an emerging country developed mechanisms to sort out solutions to many different problems encountered in public health, similar to the problem we also find in our countries. So South-South cooperation with India, Brazil and South Africa may enable us to deal with some of the major problems we have in the field of health and to put long-lasting solutions in place. Sometimes I find myself in difficult situations here in Germany when it comes to contacting institutions in Africa to create common projects that could be financed by the European Union or by the German Research Foundation. The German Research Foundation has programs focused on Africa and on major pathologies, but it's of crucial importance to have a partner directly in an institution in Africa. To find reliable partners is a very difficult task because most of teachers in charge of research are involved in politics, which makes it difficult to contact them for collaboration and cooperation. I therefore think it is very important to create a new system for those who work on the field. There are people who in general remain assistant professor forever. Excuse me for this expression because there is no mechanism to allow them to go forward. I think a solution should be found to this problem. In the Anglo-Saxon system, I know there is a possibility to be professor for a limited test period of 3 years, after which competence on the field and the effectiveness of their jobs may enable them to become full professors. These conditions of test, professorship for a limited time will allow them to work hard and serve as reliable partners on the field. This will permit them to work with European institutions or from other industrialized countries to appropriately deal with the major pathologies affecting our countries. These are just some of the points I wanted to focus on in my intervention. The door is also open for discussion, and in case you wish to contact me, you are welcome. Thank you very much.
À tout moment à votre disposition, adressez-moi vos commentaires. Elles sont les bienvenues.